Welcome to the first ever Navigating Medicare. So I'm getting an echo here. Let me try my volume 1 second.
Or we can all
Can you mute yourself, Jenny?
Yeah, we can mute. Yeah.
All right. Oh, much better. So the reason I did this was, the reason we decided to do this is I just went through the Medicare process this past quarter for the first time. I'm 49 and wanted to, and we realized that amongst all the great work that HDSA and a lot of other providers do, a lot of it's focused on getting on disability, which I got, but then beyond that, it sort of became a, well, what happens next? And I just kind of figured that, okay, I'm on disability and that'll be my thing and nothing is really going to change going forward. And I was mistaken. So I figured, based on the trials and tribulations that I went through the last 6 months at the most, I thought I would share the knowledge, and Emily thought it was a great idea, and so you guys are the first. So this will be our agenda for tonight. We're going to welcome, going to basically tell you a little bit about myself, who I am, why I'm on disability, talk about Medicare itself, how that came to pass, who's involved in that. And forgive me if I go too remedial. Some people may be Medicare pros. I realized today that the that the title of the session was all about Medicare, and that would be a very long session that I don't think I would be fully qualified to address. But it's really sort of sharing what I went through in hopes that it will give you a better experience and hopefully save you a ton of money. So we like those things. So we're going to welcome you. We're going to talk about the agencies. We're going to talk about the different types of coverage, financial planning, Q&A, all that good stuff. Any questions? And by the way, I teach, by the way, so I love, all my classes are obviously on Zoom. I teach on the college level. My preference is usually to have the audio on for everybody so that they can laugh and they can ask questions and whatever in real time, because you don't always see somebody kind of raising their hand on the screen if I'm on a roll or I'm looking at the screen. So if you have a question, please interrupt me, or if you want me to elaborate on something, please interrupt me. It won't be an interruption. I would like it to be more of a conversation, I guess, a conversation that I'm going to occupy. So who am I? I'm Jeff Steele. I live in Chicago in downtown, 49 years old. This picture was not taken today, so but I got nostalgic for it when I saw it. I'm a father of a 12-year-old daughter and 2 cats. I was tested HD gene positive back in 2013. That's when I got the gene test. I'd never heard of Huntington's before then, and continued to work full-time and do my thing up until around 2016. And that's when early symptoms began to show themselves, like anxiety and things like that, especially around deadlines. That's my kryptonite. So as a faculty person, it's all about deadlines and grading and things like that. And as things got to be more and more difficult, and I'd go to grade a test that I'd done 20 times before, and just be like, oh, I can't do this. So eventually, right around January 2016, I was like, you know what, I think I'm gonna pull back from full-time instruction and switch to part-time. And a friend of mine from the HD community had said, you know what, since you're doing this, you might as well apply for disability. And I was like, I'm not ready for disability. That's something that other people do. And so just start it, because they're going to decline you anyway for years and years and years to come. So you might as well just get it going. So that's what I did. Can I get a show of hands? How many people here are on disability? Or you can just say me.
So actually, my wife is. I'm actually a caregiver.
Okay. Okay. So I put this together for patients and caregivers alike. So hopefully you can both get something out of it. I'm going to go very remedial because, again, I've been through the process and I want to make sure that I'm covering all of my bases. So anyway, that's where I left off. A friend was like, just apply. So I went and I put in the application. When you're talking about disability, you can see over on the left side, that's the Social Security Administration. It's called Social Security Disability Insurance, SSDI. You pay into it through your paychecks for years and years and years. And if something happens that is going to, whether it's Huntington's or ALS or any of the other chronic illnesses, then you can qualify for disability insurance. They tend to have a habit of just saying no right off the bat. So everybody gets denied the first time. Don't take it personally. Then there's sort of an automatic appeal that gets put in. And that's what I got approved off of, which was kind of a surprise because I have other friends who have their HD is much further along than mine, and they're still trying to get approved. So sometimes I think it's just a matter of who's handling your case and what their caseload is like. So
the thing I'd like to add is I'm very impressed with that, because one of the things that I've learned is that also the higher level of education you have, the harder it is to qualify.
Interesting. I hadn't heard that. I'm glad I applied when I just had a bachelor's. I'm working on my master's now, but that's really interesting. Good.
Jeff, I have a question for you. So
yes.
you are on disability, but you're still working. So you can't, is there like a limit to how much money you can be making or how much you can be working and still get disability?
Yes, they have what's called they have a limit per month, and it was around $1,250, $1,280 last year. I think it went up to $1,290 or almost $1,300 a month. So I teach one class, and that keeps me just under the limit. Unfortunately, if you're a wage earner, like you're a teacher or something, it's based on off of your gross wages before taxes and everything else. If you're self-employed, then it's your income minus all of your business expenses and a bunch of other stuff. So if you have your own business, it's much easier to stay below that what they call gainful activity. That's what they call it.
So, question for you: did you apply on your own, or did you use a law firm to help you?
I absolutely used a law firm, and I'll be happy to share my lawyer's info. The great thing about disability lawyers is they only get paid if you get approved. So, they get 10%, but you know what? 90% of nothing is what, right? So obviously it got denied. She put in the appeal. I wrote up all the stuff on the application, and then she kind of cleaned it up, and that was a huge benefit. I would probably have been denied the second time, and the friends that I have that are continuing to fight the system don't use attorneys or are not using attorneys. So I highly recommend it. It's so worth the 10%. And my daughter gets like $900 a month as well, as automatically in addition to my benefits. So that's a perk. So that's Social Security, that's disability, that's the Social Security Administration. Medicare, which is sort of what this is, the focus of this is on, is handled through a separate agency on a federal level. It's called the Medicare and Medicaid Services. And Medicare has their own site. They do work hand in hand, and there are Medicare expenses that will get deducted from your disability, and we'll talk about that in a few minutes. But Medicare, for the most part, their rules come down from the federal government. There are some stipulations. There are some things that the states can change up a little bit on Medicare coverage. They can't reduce any coverage, but some states can add additional things. and Medicaid is a part of that, where if you're below a certain income threshold, then Medicaid will subsidize some of the costs of Medicare, so they don't come out of your pocket. And Medicaid is pretty much entirely run by the states, and each state has their own set of policies. So it's a little confusing. So fast forward from me stepping out of academia. Like I said, I was full-time faculty in 2016 when I applied for SSDI. In May of 2016, I stopped working while I was waiting. They don't let you work while you're waiting for their decision, so you kind of have to find something to do to make an income in the meantime. Of course, I was denied. I was eventually approved in July of 2018. And the way disability SSDI works is after 25 months of being on disability, then you're automatically approved for Medicare. So my Medicare was approved this past July 2020.
Sorry, Jeff, to interrupt
Yes.
you. Did you use the compassionate allowance when you did the application?
Absolutely. Yeah, I made sure that was all over it. For people who aren't familiar with that, there are certain illnesses or diseases that they don't increase your chances of getting improved, but they expedite the approval process. And you don't necessarily, you might not have to provide as much medical support if you have any of this list of diseases, and they're always adding to those lists. And there's some like ALS and renal disease where, like, once you get, you're like immediately get to the facility, you immediately get Medicare, and it's much faster on those. Having a terminal diagnosis will also get you on disability.
Jeff, can I jump in here for a second? This is
Absolutely.
Dave. I've applied for 3 different people. First one was denied. I won the appeal. I wrote the appeal.
Nice.
The second one was approved. The third one was approved. That's my youngest daughter. The thing that I had learned that came from our disability lawyer at HDSA is if you apply for adult onset Huntington's disease instead of just Huntington's disease, you will automatically get the compassionate allowance, which does bump you to the head of the line. I can't say enough about that. Again, it's adult onset Huntington's disease. For my daughter, it was 3 months from when we first applied to when she was approved. It was
yeah, I had the 3 months as well. Felt like an eternity during that 3 months, but then when it applied, I was pretty surprised. Yes, when you go, I mean, I'm a big nerd for policy, so going in through the red books and the statutes and all of that kind of stuff, you can see they actually have different versions of Huntington's. They've got Huntington's as a neurological disorder. They've got Huntington's as a movement disorder. So one has to do with cognition. The other one is a physical ailment. And then I wasn't aware of adult versus regular. So, and they probably, and I believe they seem to have different rules for and hurdles for any of those. And so it would appear that probably the cognitive adult is probably the holy grail that you want to pursue. So yes, so what happened?
I'll just say that I went through that for my sister, and you would think that would be the case, and it was over 2 years of working through that. So definitely not the holy grail. I'm impressed with Dave getting it done in 3 months, to be honest.
Yeah. Dave, were you denied the first time and then you were approved on appeal? Is that what happened?
Well, the first one was my stepson, was my wife Susie's son. He was denied the first time. The second time I wrote the appeal and won the appeal. The second person I worked with was denied the first time. I wrote his appeal and it was accepted. And the third time was my youngest daughter. I applied for her and it was accepted right away, relatively speaking. Yeah.
Yeah, it's there is definitely a lottery element to it, and some craft, some art, some craft, and I highly recommend an attorney, definitely, based on my
Rita,
experience.
Rita, it's Emily. Can I ask you a question? When it took you 2 years to get disability, did they backdate it 2 years so then you're eligible to apply for Medicare right away?
So interestingly enough, and when I talk about the education component of it, it actually took over 2 years. So my sister had graduated college, and because of the fact that she had a college degree, the standard was higher. So they said, well, you should be able to then go to, I'll call it manual labor type things. And as you all know, with the, not just the cognition issues, but the, Korea piece of it, that's really not possible. So and actually, she hasn't actually gotten anything yet. Her first payment should be in July, or I'm sorry, at the end of this month. And then she doesn't get Medicare until March. That said, she was a state employee, so she did have payment, she was getting disability from the state and had health care. So we were very fortunate. But again, the fact that she had a college degree helped, that was a higher standard. So I'm actually impressed that Jeff has been able to get it while working, especially on an MBA. I have a niece who's autistic and I've been working on hers, and the fact that she got a college degree has hurt her as well.
Yeah, no, I didn't start the MBA until a couple of years after having, at least 18 months after I was already on disability.
Mm.
I have found a free school, online school that does MBAs. And I was like, this is cool. And it's just good for my brain. But yes,
I don't disagree with it.
All right. So fast forward, I knew that 2 years after I got disability, that Medicare would start. I didn't really know much about that. Really, all I knew about Medicare is what I see on the commercials 24/7 on CNN. And so, truth be told, I didn't even know my Medicare had started. They never sent me a book. They never contacted me. Just one day I got a letter saying, hey, you've got 30 days left to apply for this and this, or you're going to be penalized for life. And I was like, what are you talking about? And I'm like, well, didn't you read your Medicare book? No, I've never heard from you guys. So I hopped online, and this was my understanding of it. I had no idea what they were talking about. It was Part A, Part B, Part D, Part C, Plan A, Plan G, original Medicare, and it was just completely overwhelming, and which was really the catalyst for doing this tonight. And having gone through that process and come out the other side, it now makes a lot more sense. And the terminology and everything else, and especially if anxiety is something that you deal with, then this is a very anxiety provoking experience to be going through by yourself. This is the Medicare website, which is pretty much your where all the fun happens. And everybody should be able to log into it, just like you log into Social Security and IRS and all that other good stuff. So I'll just dive in. Medicare, when you first get it, if you come through disability, meaning you're under 65 years of age, and you're coming in through disability after 25 months, then you don't have to sign up. It just automatically starts. Hopefully they'll mail you material. In my case, they didn't. And what it starts with is what's called original Medicare. And original Medicare is Part A and Part B. So Medicare is basically divided up into 4 parts. Part A, Part B, and Part D are really the main ones. And then there's a Part C, which is kind of an alternative. Part A, for most people coming in through disability, is free. And this covers your hospital stays. Anything that happens in a hospital is paid for by Part A. The good news is you don't have to have 4 insurance cards for each of them. You just get your one little red, white, and blue card. So Part A is for hospitals. Part B is medical insurance. That's kind of like your traditional PPO. It covers all your doctor visits, all your preventive stuff, dermatologists, you name it. And the key thing about Part B is they pay 80% of your medical costs, and then you're responsible for the other 20%, and there is no cap on that. Part D over on the far right side is your drug coverage. It's pretty cheap, and it's like $15. It's not a huge ordeal. If you're only on a few medicines, might be a little bit more if you have more severe. And then Part C will kind of go into, it's kind of a variation on the other 3. So the nice thing about original Medicare is if you have Part A and Part B, then anybody, any business, any hospital, anybody that takes Medicare will take you, will see you, and you don't have to worry about whether you're in network or out of network. The only out of network you can be is if you go to see somebody who doesn't take Medicare. Might be like, some physical therapist who's cash only, or some psychiatrist or who's cash only, then they would not be covered by Medicare. So like I said, you automatically get it. If you're turning 65, then about 3 months before your 65th birthday, you're supposed to sign up for Medicare, and that's a different trajectory. But for this conversation, we'll talk about the under 65s who are coming in through disability. So like I said, you get A and B. B is railroad benefits. That's not us. And you don't have if you already have an insurance plan from your employer, let's say, or a spouse's employer, then you can delay going on Medicare a little bit, but I wouldn't recommend it. And we'll get into that a bit later. Like I said, you don't need to call them to sign up for anything, but you should definitely set up, go into their website, the Medicare.gov website, and set up your account and make sure your correct address and everything is in there. The minute you get on disability, I would make sure that that's all up to date, so that they can reach you and they can send you the books and all that kind of stuff. So just to remind you, and again, I'm just showing you this again because for a lot of people, these things are very foreign, and sometimes you hear about Part A, sometimes you hear about Part B, sometimes you hear about plans versus parts, or if you see the commercials during open enrollment from like November and through December, they just talk about Medicare Advantage plans 24/7.
Thank you, Jeff. I have another meeting.
Okay, thanks
Bye.
for staying. Thanks for visiting.
All right, thanks.
So what does B cover? Medically necessary services and preventive services as well. So seeing your primary care physician, totally fine. Nice thing about original Medicare is you don't necessarily have to get referrals like you would with a HMO. So it does function more like a PPO. It covers clinical research, ambulance services, durable medical equipment, which is like chairs and walkers and things like that, mental health, inpatient, outpatient, partial hospitalization. So all my people are at Northwestern. My neurologist is there. I see the social worker there. My psychiatrist is there, and that's all just goes through Medicare, which is great. And then I pay the remaining 20%. So you definitely talk to your doctor and see if they take Medicare. If they don't and refuse to, then you definitely need to do some soul searching to decide how much, if you want to stay with them, or if you need to find a new provider. So how much is original?
Yeah,
Yes.
so Jeff, one question I guess I would have for you is there's also supplemental plans. You talked about paying the extra 20%. Do you have another plan then for what Medicare doesn't cover?
Yes, and we're definitely going to get to that.
All right.
That little supplemental plan was the source of 80% of my angst over the last 4 months, because I had no idea what they're talking about. So how much does it cost? Like I said, Part A, if you're coming in through disability, should be free. I haven't found any instances where you would pay for it. Usually you pay for it if you're coming in as a 65-year-old, and maybe you haven't paid as much into the system, whatever their logic is. But here where the stars are, if you're coming in through disability, it's free. And again, that's your hospital stays. So that's great because that's probably the most expensive thing you're going to have to pay for if you end up there. You can, like I said, you can buy into Part A if you're not getting it for free, but that's usually people who are turning 65 and have various reasons for not getting it free. Part B, down at the bottom, the new rate for that is $148.50 a month. And so that is, once you're approved for that, that will begin to be automatically deducted from your disability payments. So if you're getting just for easy math, $2,000 a month in disability, you're not going to pay anything for Part A, and Part B is going to take $150 basically per month. They have, if you make a certain amount, then they have ways of making that a little bit more. I don't know anybody who pays more than that. $148.50 seems to be the standard. So the thing that really caught me off guard with Medicare that I wasn't aware, because okay, it kicked in, that's fine. But basically Medicare they have certain periods that you can apply for coverages, and one of them is what's called an initial enrollment period. And the initial enrollment period is when you're first approved for Medicare, when it kicks in. So for me, that was July 2020. And it starts 3 months prior and goes 3 months after. So it's sort of this 6-month window. That's the initial enrollment. And during that initial enrollment period, the supplemental policy that was just asked about, and some of these other coverages, you can apply for, and you will be automatically approved, and they do not have any pre-existing condition penalties. So you're automatically approved as somebody in the best possible health, which is great. And that's also true for the drug policies as well, Part D. So where I got my first shakeup was I got this letter from Medicare saying, hey, it's almost a month since you started Medicare and you haven't applied for your Medicare Part D drug thing. And I'm like, well, I only have one prescription. I don't really need it. And like, well, if you don't do it, then you're going to be penalized for the rest of your life, an extra, a 20% penalty for as long as you have it. And I was like, gotta be kidding me. So I ran out, hopped online to this digestion of what the heck is Part D, and found a plan and got on it. And it's about $15, so no biggie. But the same thing goes with Part A and Part B. Now, in Part A, you automatically start, so you don't have to worry about that as an enrollment issue. But with Part B and the supplemental policies that we're going to talk about shortly, if you do, if you sign up during your initial enrollment period, then you're automatically approved. You're approved at the best health rate. You're considered a non-smoker. But if you miss that initial enrollment, then you pay a 10% penalty for each 12 months. So they even have an example down here where you basically could end up paying a 20% penalty for as long as you have Medicare. So it's pretty brutal. And I almost missed this window completely. And the interesting thing is, everybody I talked to in Illinois, specifically Chicago, with insurance agents and things like that, all said, well, you have it's 6 months from the start of Medicare. But when I spoke to Medicare, they're like, no, it's 3 months prior, or 3 months after the start. But it turns out that, remember we talked about earlier that some states can change things up a little bit. In Illinois, your initial enrollment period is actually 6 months from your start date, plus the 3 months prior. So you have a little bit extra window, which is nice. That sure saved myself big time. So does that make sense? You really have to watch out for those, Plan D and Plan B. You can, and every year during the open enrollment, you can switch plans, but after that initial enrollment, anytime you switch plans after that, they can do a medical background check on you. And obviously, if you have something like HD, like I have, you're probably not going to be approved at all, let alone get a good rate. In fact, during the initial enrollment, they're not even allowed to ask you if you have anything. I had one person ask me if I had anything, and then he denied me on the phone, and they're not actually allowed to do that. Oops, here. So it's going out of order. There we go. So we're back to this slide because, as I mentioned before, the premium for Part B is up $148.50 plus that 20%. So the thing you need to understand with Part B is that you're paying $148.50 a month, but Medicare is only paying 80% of those medical costs. And these are pretty much all your medical costs. If you're not in a hospital, then it's covered by Part B. And it does not include dental, by the way. So Medicare pays 80%, you pay the other 20% with no caps, no limits. So this is not a 20% like copay where you pay, $40 when you go see the HD clinic. This is a co-insurance where you're paying 20% of whatever those costs are. So that can really add up, and you definitely don't want to get stuck with having big medical bills, especially if something goes wrong. So what do? You need to find a way to plug up that 20% so you're not stuck with the bill. And that's where the supplemental plans come in. So remember, we talked about Part A, hospital, Part B, medical expenses. Part D, as in Delta, is drugs expenses. So Part B has that 20% gap, and you can basically get what's called a supplemental plan. Sometimes they call it a Medigap plan. This is the exact same thing, that will plug up some portion of that 20%. And they have a bunch of different plans. You can see them all across here: A, B, C, D, E, F, G, K, L, M, that offer a range of benefits. Some offer more, some offer less. And I'm going to stop sharing here for 1 second. And I'm going to switch over to, does anybody have any questions while I'm segueing here?
So I do. I have a question. How do you know, for in my situation, I'm a caregiver, I primary wage earner, and I have the insurance.
Okay.
My wife had been diagnosed in 2013. We had disability in 2013. She's been on Medicare Part A, and maybe my own misunderstanding or just the difficulties with everything. I had a hard time just understanding what's the difference in cost in the end of the day if I continue to pay for insurance for my family and keep her on Part A and not get deducted that $144, for Part B. And so I have pretty good insurance through my work.
Okay.
But obviously I pay, let's say, a good $500 to probably have a month to have her on my insurance policy.
Sure.
And I've always been having trouble trying to weigh the difference. So what if I took her off and enrolled her in Part B, right? And then I'd still have to pay for a supplemental plan. And in the end of the day, is it the same cost on average? What is the consensus out there for people in my situation?
I'm about to show you. Excellent question and very thorough. And especially if you have your own insurance, and they do have, if she has good coverage under your policy, you do have more options about, the initial enrollment period. And, if she's on disability, she's automatically going to qualify anyway, whether you activate Medicare or not, is, kind of becomes a financial decision, I think, more than anything else. So this is the Medicare site. I just logged in on mine, and you can see me Part A and Part B down here, coverage started. And so when it comes time to kind of figure out what plan you want to do, you can basically push my plans and coverage, and you can scroll down and find and compare 2021 plans. And again, I had no idea what I was doing going through all this. And now it's going to start asking me some questions. Do I just want to learn about Medicare options? Do I want to look for a Medicare Advantage plan, which is more like an HMO? Do I want to look at a drug plan? Medigap policies are not allowed to be bundled with Part D policies. There are some people who are grandfathered in. So Medigap, which is the supplements, is what you want to choose. And then it's going to say, well, what's your zip code? Because it does matter. And age.
Yeah, do you know if the prices are different in different states, or is it across the board the same?
I believe they are. I think they're definitely different in states. It's also less for females than males, and obviously if you're a smoker. But during your initial enrollment, the smoker thing isn't even an issue, if that's an issue. So here you can see all these Medigap plans: Plan A, Plan D, Plan. And I'm just kind of like, ew. And you can see the benefits, and you can kind of compare the difference, and you can also see the ranges from $195 to $700 a month for Plan G. This kind of gives you more details, like the hospital stays, how much it covers, and what you pay. So there's a lot of info. Go back to G. G is by far the most popular. Spoiler alert, that's what I got. But this is where my head exploded, because when I was like, okay, well, I guess I'll just pick a company, and all of a sudden I'm like, what? And of course, you don't see the prices here. There's just links to the websites, and they just keep going and going and going and going and going and going and going. So 54 different policies. They're all Plan G, but each company has their own versions. You probably recognize some of these names: Blue Cross Blue Shield, Capital Life, Central State, who all these people. Well, I don't like to make uninformed decisions, so I was the guy who went and called all of them. What I did was kind of really sunk my teeth into what the difference between these supplement policies were, and then kind of figured out which one was best for me. And then at first, of course, like anybody else, I go online and you can find these online quotes from various companies. So here's all these supplement plans. Can you see back to my plans? Or are you still on the something else? All right.
We see find a Medicare plan.
Okay. All right. So now here's all these different plans: A, B, C, D, E, F, G. And what you can see is what do they cover and what don't they cover. If there's a check there, it covers 100% of that thing. If there's an X there, it doesn't cover anything. If there's a percentage there, which tells you what percentage it covers. Me, I naturally gravitated to G because that seemed to cover everything, or the most things, right? There's a couple plans like C and F that are no longer offered. They're still listed because, again, some people were grandfathered in, and those paid the deductible as well. And we'll talk about the deductible. Basically, the deductible for supplement G, which is an annual deductible. Anybody who has insurance obviously is aware of deductibles. Not to be alarmed, it's only about $200. So once you pay your first $200 in medical costs, you're through that. So again, having HD, a lifelong illness that's going to, progress, maybe 1% a year, but who knows, nobody knows what trajectory any individual person is going to take. I like to hedge my bets and get the most coverage I can for the least amount. Again, based on my research, Plan G seemed to be the winner. It covers all of Part A's co-insurances and hospital costs, which is your hospitals. It covers all the co-pays and the co-insurance of G, blood, hospice, skilled nursing. It is not a long-term care policy, so yes, it does cover some skilled nursing, but it's not that per se. Part A deductible, there isn't really one. Part B, again, none of them. They all have a deductible now. And then Part B excess charges is an interesting one there, because some doctors, when you go on Medicare site and you look for doctors who take Medicare, you have to look for something that's called taking assignment. And if they take assignment, that means that they agree to charge Medicare's sort of agreed minimum rate, and Medicare will pay that full rate. If they don't take assignment, Medicare will pay whatever Medicare agrees to pay, but they can, if there's more on top of that, then you have to pay that. So some of these, cover a lot less, and those policies cost a lot less. Down at the very bottom, you can see K and L have deductibles that once you reach those annual deductibles, then the policy kicks in. G also has what's called a high deductible policy, and it's all the same coverage, but it has I think it's about a $2,300 annual policy. And because of the deductible, it becomes cheaper. And you can see that all over in the notes. So again, this is about filling that 20% gap that Part B doesn't cover. So that's why they call it a Part B supplement. So in terms of the jargon of this, this would be Part B Plan G.
Jeff, I have a question. So if you pick plan G and you're not going to get a deductible for Part B, you're still going to be paying your deductible for your HD outpatient visit, which tends to be very expensive. Although maybe it's less expensive for Medicare rates. I know, like for private insurance, maybe they bill less for Medicare rates, so it's not terrible.
Right. I had Blue Cross Blue Shield up until Medicare kicked in. And yes, the deductible was a lot more. It was like $1,500 or something a year, which was pretty painful. And then it covered, pretty much everything after that, except the copays. Now that I'm on Medicare, I have AB and have the G, again, you're still paying for the Part B, you're paying your $150 a month that gets deducted from your check. Then the Plan G has its own insurance. It has its own monthly premium. And plus there's a deductible for Medicare. And I will have a slide that has all this itemized very shortly. So here we go, brass tacks. Oops, sorry. So in addition to Plan B, again, B $150 a month. B has a $200 deductible, which is, not much. Then how much does Plan G cost? So when I needed to sign up for Plan G, I asked my medical professionals, what should I do? And, they were aware of it, but they didn't know so much. They said, you know what, probably go with Blue Cross Blue Shield for your Plan G. Everybody knows who they are. They're in network with Northwestern. And I was like, okay, that seems reasonable. Plus my daughter lives in Los Angeles, so I go back and forth. So I need to make sure that wherever I'm going, if I end up needing a doctor, that I don't have to worry about being in network or out of network. I just want to, most hospitals most ambulances take you to a hospital, and pretty much any medical facility like that is going to be in the Medicare network. So what did I do? Like I said, this little script on the left was my spiel for about 75 calls and probably 100 internet quotes. Lots and lots of insurance agents and spam and everything else, which is very exciting. I applaud my girlfriend for sitting next to me, listening to this over and over and over and over again, while having the commercials blasting 24/7 as well. So it was an interesting time. So this is, again, if I had gone with this is the range of quotes that I got back sorted. The initial, the initial quotes for Blue Cross Blue Shield. Unfortunately, there we go. It was being covered up by. There we go. So Blue Cross Blue Shield, do we see it? CBS was around $5,000 a month, I believe. And again, I didn't know any better. That was my first call. I call up Blue Cross Blue Shield. How much is this going to be? $5,000 a month. And I just figured, okay, my new reality is that I now have to pay $5,000 a year. Sorry, not $5,000 a month, $5,000 a year for this Plan G. And it, talk about anxiety and panic attacks and everything else. But I was just like, you know what, there's got to be more. So I just kept calling, and they would get, some insurance companies require you to work through an agent, and they'll, take your number, and that agent will call you back, and that agent will give you a quote on that company, and they'll give you some quotes on some other companies. And just through all of these phone calls, big factor being that to keep in mind is they're only going to quote you the policies that they get commissions for. So that was the big lesson that I was not prepared for. was, I just want to know who's the cheapest one. And, Cigna started coming out. Okay. A lot of people started talking about Cigna and quoting that. And I was like, okay, great. Well, now I've gone from $5,000 a year for Blue Cross Blue Shield all the way down to $3,400 a year for Cigna. So that basically knocked my medical in half, just from doing all of these calls over and over and over again, and kind of prying these agents to give out any more information that they could. And what I learned in this process, like I said, the agents are only going to quote companies they get commissions for, or if they're contracted to them, then they will only quote that company. And the other thing I learned is that the agent's fiduciary duty is to the insurance company, not to you, the client. So during all this, the absolute lowest one I was able to get it through, and this took a week and a half, the calls and maybe 2 weeks. And my initial enrollment period was about to expire, so it was neck and neck, because I didn't realize that was actually an issue. So one agent mentioned his company Sentinel, and I was like, great. Or this one, Everence was actually the cheapest for a long time. Everence was interesting because they are a fraternal organization of Masonic or lodges, or Mennonite lodges. So in order to get their policy, you have to not only, and I was actually going to go with them because they were the cheapest one that I found for a long time, and their policy says that you're signing up for the policy and you're signing an agreement that Jesus Christ is your Lord and Savior, and everything that you have received in your life is as a result of your relationship. And I was just like, well, that's interesting. I don't remember that provision in the statutes, but some of these companies are very small, nonprofits, and others are big insurance companies. But one agent mentioned a company called Physicians Mutual as being the cheapest, and I was like, well, what's that? And then he was like, oh, never mind, not important. And they wouldn't say anything. And I happened to talk to another agent during this, and I asked about that, and they mentioned that Physicians Mutual is out there, but they don't work with agents, and that's why nobody quotes them, because they don't do commissions, they don't deal with outside agents. All their agents are in-house, basically salespeople. So I tracked down Physicians Mutual and got a quote from them, and my jaw hit the ground because now my monthly payment had just dropped from $430 a month to $200 a month for their Part G, or $2,400 a year. And then they had an additional policy called an innovative G, and which dropped it down to $161, or basically under $2,000. And what that innovative G, which I was skeptical of at first, but after I kind of stewed on it and digested on it, it was fine for me. What that innovative G is it's a G policy, it's a G plan, but for the first 2 years of the policy, 2 or 3 years, it's a high deductible G. So your deductible is $2,000 or $2,300 a year, something like that. And then after those 2 years, that high deductible part drops off, and it just becomes a regular G, but your monthly premium stays at the 161 all the way up until you're 65. So looking at my medical needs, and I see my neurologist and psychiatrist quarterly, basically. So for me, it seemed like, what, I think I can, I think I can make this work and do the, do the lower, or the even lower one. And yes, of course, I had to factor in, well, that high deductible that I'm paying, how long will it take for that to be paid off? And it was like, I think after 3 years of the lower policy, I had paid off the deductible. And the interesting thing is, it's 2 years, I believe, But because I happened by coincidence to be signing up in November or December, that counted as one of the years. So November, December was the first year. This year is the second year. And then I think January of next year, I'll be on the regular G, but it's only going to be $161 a month. So, you know, it's a 20% difference just between those two physicians mutuals. You can't really go wrong. I mean, some of these are upwards of $700 a month, $10,000 a year. They're all the exact same plan. Very, 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 very few of these companies offered anything in addition to it. Some of them would give you discounts, like Cigna, if you applied online, would give a 5% discount. Or if you already have a policy with that particular insurance company, they might give you a discount on your plan G. So pretty weird. So what does this look like in real life? So here's me. Okay, my gross SSDI benefits as of 2021 is $1,988.40 a month. Again, Medicare Part B, the one is deducted from my check. So the net amount that I receive each month from Social Security is $1,839. So I basically just assume that that's how much I make. I just pretend that, you know, I got a pay reduction because, you know, and it was frustrating because I set up my life, I set up my apartment, my living, and all that kind of stuff based on the $1,988 that I was receiving for the last 2 years. And then all of a sudden, when Medicare kicks in, they're like, by the way, we're now deducting $150 for Part B, and another $15 you'll have to pay for Part D, plus the plus another 161 for the supplemental G, and the part, and then the deductible that you pay annually is 198. So that's, you know, if I compare it to what I was originally making in 1988, I'm basically paying 20% for my medical expenses, which is pretty big as a number, 18% technically. But the great thing about G, and we'll go back there just a second. The great thing about G though is, you know, if, you know, I was challenging myself really to get the 161, and that's what I'm going to be paying until I turn 65. It's when you get to 65, you get another open enrollment period where you can switch to a new plan or a new provider if you want. Also, believe it or not, these rates all go down when you turn 65. So on the plan G, you are always going to pay more because you're a younger person on disability. So they just assume there's something wrong with you. And so if you're looking online and you see these amazing quotes, you might be looking at a quote for someone who's 65 or older. So these rates are actually going to go down once you turn 65. And they can go up incrementally each year as well, you know, as cost of living and things like that, but, you know, it's pretty incremental. The thing I want you to remember with the plan G though is, you know, once, you know, let's say I'm just doing regular G. Once I pay my $200 annual deductible on the G, I have no additional medical expenses for the rest of the year, right? I'm paying, you know, outside of paying for Part B and paying my annual Part G premium, nothing, no copays, no doctor visits, no overages, nothing. So for me, you know, while I do have an inclination to want to pay the least amount, I get much more comfort in being able to control my budget. And if I know, okay, you know, what Plan G gives you is the peace of mind and the clarity to say, outside of my premiums, I don't have to pay a squat for anything. The only exception being is if you're traveling, you have to pay 20%. but other than that, and that's a fantastic peace of mind. Yes, there are cheaper supplemental policies and an N and ABCs and all this kind of stuff. So that's something to think about. And yes, there's no doubt about that. that 20%, losing 20% of my monthly pay definitely caught me off guard. I wasn't ready for that, and like I said, I had set up my whole sort of cost of living and apartment and everything else, so that if HD suddenly put its foot on the gas and that I wasn't going to, that I'd still be able to afford everything just off of my disability. But like I said, I also teach and do other little entrepreneurial things. But that's it. That's the journey. That's what I've learned. Any questions? Right? I felt the same way.
Jeff, if someone decides to forgo Medicare because they're on their partner's private insurance plan when they turn 65 or when they become disabled, go out on disability, do they have to wait for open enrollment to sign up for Do you know if they have to sign up for open enrollment then, or do they lose that way? Is there a penalty if they hadn't signed, or is there a penalty, or do they just click on a box that's like, I don't want it right now, I'll check back in with you in 5 years? Do you know?
I think it's the latter. From what I've seen, yes, if you have your own policy, you still get, I think maybe Part A or whatever still kicks in. And to go back to the earlier question of should my wife stay on my work policy or go on Medicare, with the work policy, a lot of those are going to have lifetime limits or yearly limits. They might have higher deductibles. There might be things that aren't covered. There might be in networks or out of networks, things like that. So the upside to Medicare is, like I said, with the G, 20% is obviously a big number as a percentage of my income, but for actual cash, it's like $500 or something. I think I'm spending on insurance, and that's pretty cheap. I mean, I think that's probably what any person is going to pay for. If you go on the healthcare sites, the Obamacare site, I think you're going to pay more for less. So to answer your question, I do think if the person has insurance, from what I've seen, they also have the option to forego it for later without a penalty. But you can't just assume that. You definitely have to communicate that to them immediately. Especially, it basically kicks in about 3 months before your start date, and the start dates tend to be in July, from my experience. And so you go into July and you buy your policy for July, and you just contact Medicare. And
so I think what I would say, I don't know a lot about that, but I think you need to check with your employer because there's some very specific rules. So for my sister, I know that she does not have the option. Medicare would become her primary and her work becomes her supplementally. And if you don't take that, you could really screw it up. One of the guys I work with, he had cancer and he qualified for disability. So, he's been working with Medicare because, he doesn't want to do the Medicare, but you just can't necessarily reject it either. So, it's very complicated. And if you make a mistake, it could be costly.
yes, thank you for bringing that up, Rita. That is correct. In all cases, if you have your own insurance, Medicare still becomes the primary insurance, and that insurance becomes the secondary insurance. But you still, and they will only, I'm now remembering because I happened to see it today, and they will only take I think you can only stay on, your wife would only be able to stay on the work policy if it's a company that has more than 100 employees or more than 1,000 employees or something like that. So if you have Obamacare, if you have, small, from a smaller business or your own policy, then Medicare is not going to allow you to stay on that. And again, if you ignore them, then they're going to penalize you for the rest of your life.
Yeah, and the only other thing I would say that I've learned over the years, and this isn't specific to HD, but when I had gone through the process to get my mom and aunts and some other family members on, the prescription drug coverage, I thought one and done, you do all this work and you don't have to look at it again, but it's really something just like with, employee plans. Each time you have to go in and do the work, and it's a lot of work every year, because it seems to me that if you just stay with it, the plans assume that you're not going to do your homework, and it will end up costing you a lot more because you typically have to tweak the Part D for the drugs.
Yeah, that is absolutely true. It's something that has to be maintained.
Which becomes very interesting because as you get older, it becomes more and more challenging to do all this stuff.
Yes. Does anybody want me to go over Part C, the Medicare Advantage versus original Medicare, or does everybody here already have a grasp on that?
I'm good, thank you.
Okay. All right. So yeah, the short being it's more like an HMO, but the premiums are super cheap. Some are even free, but they're very restricted, and you have to be in network and referrals and all of that, and especially if you have family in various places, I don't really think it's worth the risk.
HMOs are so much harder with HD because when you need referrals to different things, it's just another extra thing you don't want on your plate to be running around getting referrals and approval for things.
I agree. Well, that's it, folks. That's
Thanks,
all of
Jeff.
your questions.
I have a question.
Yes.
So I'm wondering, if I don't have the ability to call 100 different or 75 different companies, is there a way for me to find, out how the different policies would compare for me? Is there like a simpler method?
There isn't a simpler method. Like I said, the agents are going to just quote the ones that pay commissions, and that was double. I mean, all of those were double what I ultimately found. Like if you're female, your rates will be cheaper than mine. I was actually talking with Emily earlier about having gone through this. I said, I wonder if there are some people out there who just don't want to deal with it and would just be like, hey, pay you, $50 an hour or $100 an hour and just go do it for me. And I was like, it's an interesting concept. So that's something I'm thinking about as well, having been through the trenches. Outsource, especially if you're anxiety prone like me.
What if you did a Google search for Medicare plans that don't have a insurance broker, sort of knowing that there's going to be very few of those and just reaching out to those?
Even on,
or is it hard to
even
find
on all the internet ones are same thing. They're not going to give you they're not going to quote a policy that doesn't give them a commission.
Wow.
So yeah, like I said, Physician Mutual has been around 100 years. Never heard of it. It's in Omaha, Nebraska, and I couldn't believe it when I found it.
And it's not listed on the Medicare website. They don't show up as policies on the website if you search.
You know what? I don't know. Probably. But I think it's one of, you saw the whole list I mean, there are tons, and there's a lot of new companies kind of jumping into the supplements thing. So there's a lot of new entrants to the market who don't have any really experience doing it. So that's interesting as well. And I'm happy to refer physicians as well. If you want to know who my insurance person is, I'll send it to you. I think they're just now opening a Chicago office. Otherwise, it's Peoria. All right. Thank you, everybody.
Thanks for coming.
My email is in the presentation, and they're going to make that available. I'm happy to send you my deck if you want. So you can just email me if you have any questions. Otherwise, have a great night.